Hello, everyone.
Hello.
Hi.
Okay, so thank you guys for coming. Of course, my voice went out, so if you need me to repeat anything, just let me know. So, in order to graduate with your bachelor's, you have to complete your capstone project. So, my capstone project is on bedside shift report and how it affects patient satisfaction. So, part of our research involved finding 5 studies to support this, and they're on the table. They're labeled study 1 through 5 if you want to look through them as I talk. And then I also included my nursing research paper. Okay, so as a traveler, when I picked a topic, I wanted to pick a topic that, in case I was moved from this hospital, it would be relevant at other hospitals. So I picked patient satisfaction, patient dissatisfaction. So when you start to do research on how to improve patient satisfaction, you're gonna find a lot of different ways that patients aren't happy. And a lot of those things aren't relevant to us. So I decided to pick a topic that I knew us as nurses could fix, and that is bedside shift report. So the population impacted is the patients we see on this floor, which is adult medical surgical patients. The type and amount of information provided by nurses about the patient's condition contributed as one of the main causes of patient dissatisfaction. So we know that takes a lot of time at bedside shift report, and that's typically because patients have questions, they have comments, concerns, and this allows us to educate them at the bedside. Patient education has been linked with positive clinical outcomes, and a couple of these are listed. And those are improved adherence to a therapeutic regimen, reduced anxiety, and enhanced ability to cope with symptoms. So these are just a couple reasons why we do bedside shift report. So like I said, I have 5 research articles. They're laid out over there, and I'm gonna just briefly run through them. I know you don't wanna hear all the details about them. So this first study took place in Australia in 2018. The intervention involved a plan that included bedside SVAR scripts, posters, lanyards, and a handover flow sheet. So results did show that bedside shift report increased patient satisfaction in 2 categories: patients understood more, and also the patients felt more involved. And these were significant results. So the second study occurred in a acute care designated teaching hospital located in the Midwest. They just used bedside scripted reports. These also, the study also supported, the results also supported that bedside shift report increased patient satisfaction on one of these units. The third study was at a community hospital. Sorry, I plan on it being up here so I can kind of talk more to it, but it's down here, so sorry if I'm not looking at anybody. In the nurses keep you informed section, the post score increased, as well as staff included you in the decisions regarding treatment. So the fourth study is a little bit different. Instead of focusing more on bedside shift report and patient satisfaction, it focuses on compliance. So this intervention was the introduction of a wall-mounted device and connected mobile app. So kind of like our virtual sitters, from my understanding, and it would go to an app. The purpose of this study was to determine if using remote surveillance helped to improve bedside shift report. So results from this showed a major increase in compliance, from 3 to 41.9. And then hourly rounding increased from 35 to 77%. So a major increase in compliance rates, which is something that would, I think this unit, with the way it's equipped and how advanced this hospital is, I think this would be a really good thought for this unit. So the fifth and final one, just used a standardized SVAR that focused on patient involvement at the bedside. These results also supported that patients from the intervention ward scored statistically and significantly higher on the measurement of information exchange between caregivers. So this led me to form my PICO statement. So in adult inpatient medical surgical units, how does the implementation of a nursing bedside handoff compared to current handoff practices as report at the bedside, report at the nurse's station affect patient and family satisfaction of nursing care? So the question is, how could we measure this? Like many of the other studies, we could measure with patient satisfaction by patient surveys, so before and after implementation. And then this is the big part. So this is where I'm going to need you guys to talk back to me. Just a couple discussion questions. So we have to have a second part of our research paper, and the second part needs to focus on, the feedback from you guys. So the first question is this something that's appropriate for our unit?
Yes.
Okay.
Do you want us to elaborate?
Kind of, yes.
Okay. Yes, it is, because our patients most of the time are alert and oriented, or if they're confused, they have family members who feel like they don't know what's going on. So it gives the patient and family a chance to ask questions, as you have previously stated.
And then the second one is, how will bedside shift report positively and or negatively impact the nurse's obligation to provide holistic, culturally sensitive, and patient-centered care to patients on the unit? So these questions were for every Capstone project, not just mine. So whenever I looked at this, I looked at patient-centered care. So how will bedside shift report improve patient-centered care? Which, we're going in, we're talking to them, so.
Yeah, the patient has a chance to ask questions, clarify things, tell their story.
I don't know if, the holistic and the culturally sensitive could really apply in this situation. I don't know if you guys could think of anything where it would.
Maybe just reminding, like, if you have a patient who's vegan, or some of those cultural, like, who do we get a lot up here? I can't think of them. Burmese. And like their food. We can make sure that, oh, hey, by the way, they don't eat da-da-da-da-da. Or their family's bringing them this, and this is how we're taking care of that. Or this has been sitting here for how long?
So some things that, may be lost in report if we were to do it. At the nurse's station, we can talk about it at the bedside, and, maybe seeing the patient will spark some of that.
Patient safety.
Are there any legal or ethical implications for nurses?
The main one that comes to mind is just making sure the family that's in the room is okay, like that the patient's okay with having their information shared.
I know with visiting hours, everything's kind of starting to go back to normal, so, they might be here. But I also know that this unit does a lot of 3 to 3, so at 3 a.m., it's not really something we need to worry about, but
Right.
they do 7 to 7, so it's a little bit different. And then how will bedside shift report positively and or negatively impact nurses? So workload, job satisfaction, ability to provide safe care. So whenever whenever somebody tells you you need to do bedside shift report, the first thing I think of is, ugh, that takes so much time. So, that's one negative that I think of. But then, there are positives that.
Well, then it's an accountability factor as well. It keeps me accountable as well as keeping my coworkers accountable, which means better patient safety and outcomes. To be like, oh, hey, yeah, we did have to increase their heparin drip to whatever because they weren't therapeutic, or, oh no, the patient pulled out their IV and they haven't been getting heparin. So things like that.
Yeah, or like Victoria just mentioned, that things you might have forgotten about unless you were there in the room.
Or like making sure that the patient's dirty or clean, or
Turn.
oh, hey, we just turned them, or actually I need help turning them, do you mind helping me? Oh, while we're turning, let's look at that wound on their behind.
I feel like it helps a lot too, because you get a report and then you go in there like the patient's completely confused and you're like, this is my first time seeing her, I don't know, the nurse is gone. Yeah, so that kind of helps. So that way you can.
Just to kind of add to that, I feel like there are a lot of codes and rapid responses that are always called at shift change. So, I don't have any support, for that, but I would assume, you get busy and then, like you said, hold you accountable, both nurses accountable. So can help you from, so you don't get burned. Like, oh, I never gave that, I never got a report from that nurse. This kind of, if we were to document that somewhere, then that would be good. And what are some barriers, which we just kind of talked about? Can you think of any other barriers? I think time is probably just the main concern. And then who else should we involve when implementing this intervention? Patient, and then patient family maybe if applicable.
We can let the PCTs probably know too, like, hey, just be aware for call lights, or we'll be in these rooms so we can check on these patients too.
And when I started this, I had no clue that we were gonna hit bedside shift reports so hard, So
it's a very timely subject.
Because I know we've been talking about it in huddle and emails, and that leads to my next question: how are we currently implementing bedside shift report?
Yeah.
So I know we've got rounding nurses, we've got people coming in and holding you accountable, which to me is the best way to make sure that I actually get in there and do it. So someone's saying, hey, we're doing this now. And
I also like that we have power hour before, so then you can make sure and tidy up all those loose ends, and that's another way we can implement the PCTs. Like, hey, it's power hour. Like, let's make sure all these patients are turned and ready to go.
So do you have any questions, any comments? Okay. And then my references, which nobody wants to see. So and that's it. Oh.